Good afternoon, everyone. Let me introduce my PhD thesis about investigations of influencing factors on the fit of ceramic restorations. My name is Adrienn. I'm a dentist at the Department of Prosthodontics. My supervisor is Yvette Roth, and my SMS is Kata Kelemen. My vision is to offer patients the highest level of precision and accuracy in dental restorations, ensuring optimal oral health and satisfaction. And my mission is to deliver evidence-based recommendations to dental professionals. Here you can see my two ongoing projects. My first one title is investigating the efficacy of different finish line designs on ceramic restorations. This will be a systematic review and a network meta-analysis. Ceramic crowns are extensively utilized in dentistry because of their outstanding aesthetic and excellent biocompatibility. The fit of this indirect restoration is increasingly important for long-term success. Biological failure of fixed prosthodontics is between 85 and 93%. Inadequate marginal and internal fit can lead to microleakage that can develop in caries, that can lead to pulp infection and endodontic treatment, or can cause gingival inflammation and periodontitis. The type of finish line design is a crucial factor for marginal adaptation. So one of the unmet needs in dentistry is to find the optimal finish line design that can preserve tooth structure and ensure the marginal integrity as well. So our aim is to investigating the different finish line designs on ceramic restorations. Here you can see our clinical question. Is there a difference between preparation designs regarding marginal and internal fit? Our population will be the ceramic restorations, and we have 4 intervention and comparators: the chamfer, the rounded shoulder, the shoulder, and the vertical edge finish line. And our outcome will be the marginal and the internal fit. Our null hypothesis is there is no difference between preparation designs regarding marginal and internal fit. And our clinical and research implication is to help clinicians to make a proper selection of finish line design for ceramic crowns and to educate students with evidence-based knowledge in practice. Here you can see that we have conducted our systematic search on November 25 in 4 databases with the following search key. Let me introduce my 3 key articles about this topic. My first key article strength is it's comparing 3 different finish line designs in the same article with a direct comparison and with a large number of measuring points. The limitation of this study, it's an observational study, so it did not replicate the masticatory forces or the aging of the material. My second key article is a randomized control trial. 2 types of ceramics are under investigations with 2 different finish line designs in a direct comparison. However, it's also an in vitro study, so did not totally replicate the real clinical situation and is tested without cementation. And my third key article, 2 types of ceramics are under investigations with 2 different finish lines with a direct comparison. And the limitation is the same, it's an observational study, and the internal fit of the crowns was not measured, and the number of the measurement points was smaller compared to other studies. Here you can see my flow chart about the selection. And after the title and abstract selection, I have found 63 articles. And here you can see my project progress. So we found this topic feasible. I have submitted the Prospero registration, and I have done the duplicate removal and the title abstract selection, and I've started the full text selection as well. And about my second topic is about investigating the effect of wax butter manufacturing techniques on the fit of lithium disilicate restorations. This will be also a systematic review and a network meta-analysis. Lithium disilicate ceramics are widely used materials because of their excellent aesthetic and mechanical properties. It can be processed either with a lost wax hot pressing technique or a CAD/CAM milling procedure. The first step of the pressing technique is to make an anatomical wax pattern. Then we have to invest and burn out the wax to get the negative likeness of the wax pattern. Then we have to press the ceramic material to this cavity to get the exactly same form. So the fabrication of the wax pattern is a critical step for the long-time success of the final restoration. Conventionally, this wax pattern is made manually by a dental technician. However, it has many human-related factors. But with the development of technology, there are different kinds of CAD/CAM manufacturing techniques, for example, milling or the 3D printing procedure, so we can fabricate the wax pattern with this. So we would like to know with which method we can achieve the best adaptation for the final restoration. So our aim is to investigating the different manufacturing techniques of wax pattern on ceramic restorations. Here you can see our clinical question. Is there a difference between manufacturing techniques of wax pattern regarding marginal and internal fit? Our population will be the wax pattern, and we have 3 intervention and comparator. The first 2 are the CAD/CAM manufacturing techniques, the milled or the 3D printed technique, and the third one is the conventional manufacturing technique. And the outcome will be the marginal and the internal fit in micrometer. Our hypothesis is that CAD/CAM manufacturing decrease the marginal and the internal gap in pressable ceramic restoration, and this is our clinical and research implication to decrease this gap. Here you can see my preliminary search key and the preliminary databases. And I haven't found a previous systematic review or meta-analysis about this topic, and I haven't found a Prospero registration either. And about my 3 key articles, my first one is a direct comparison with a statistical analysis, and this is the strengths, and the limitation is an observational study, and only compare the milling and the conventional technology. The second one is comparing 3 different technologies, so the conventional, the milling, and the 3D printing one, also with a direct comparison and the statistical analysis, but the limitation is it's an observational study, and the internal fit of the crown was not measured. And my third key article has a large number of measurement points, but the limitation is the same, and it's only comparing the milling and the conventional technology. To summarize my aim, I would like to submit my first article in August and my second one in December. And thank you very much for your attention. And I would like to finish my presentation with the word of Richard Dawkins, that the science is the poetry of reality. Thank you.
Very good presentation. Congratulations. I had a question on the first project. So you mentioned that your null hypothesis is there's no difference between the designs. So what is your hypothesis, and do you expect that any of those designs is better in terms of your outcome?
This is what I want to know, because there are, this is 2 kinds of preparation design, the horizontal and the vertical preparation. And for example, with the vertical preparation design is more minimal invasive. So if there's no difference, maybe you can use that for minimal invasivity. So we have to check this for ceramic restorations, because we know that for ceramic fused to metal, what kind of preparations we use in our daily practice. But with the ceramic restorations, there is no evidence-based recommendation.
Thank you very much.
Thank you.
And I think I'm the second questioner. I'd like to congratulate for your presentation. It was really nice. And I have a question about the biological failure according to your dental restorations. Do you know any behind factors that can cause these failures?
Yes. If there's a big or increased the marginal gap in the ceramic crowns, then there will be a plaque accumulation and the cement dissolution, and in this way the bacterial infection has a larger effect, and in this case it can cause secondary caries that can lead to pulp infection or endodontic treatment and a periodontal lesion as well.
And it was mentioned in your key articles as well, right?
Yes, of course, yes.
Okay. Thank you very much.
Thank you.
Congratulations to your presentation. My question is about your first topic. Do you know which preparation technique is the most common in Hungary? And when you did your preliminary search, did you find some data about the marginal integrity of these different techniques?
Mm-hmm. I think in Hungary, in the past, the vertical preparation was popular, but nowadays I think the chamfer one, because we teach this kind of preparation at the university, but mainly we use for ceramic fused to metal restorations, so this is why I want to investigate this. And for the second question, in my key articles, I found that the rounded shoulder has the best marginal integrity. So this is why I have to check for many articles. But what are the recommendations?
Thank you.
Thank you.
My question is regarding your first project. You mentioned I'm no dentist, but you mentioned the biological failure rate is between 82 and 94%. This seems exceptionally high. What is the time frame in which this is this high of a percent? So if it's 1 year, it's really bad, but for 30 years, it's almost acceptable. So just educate me, what's the time frame?
We planned this restoration for about 10 or 50 years for the patients, and this is in this interval. So the main failure of these dentures are the biological failure because of the secondary caries. So this is the time limit when they watch this in these articles.
Thank you.
Out of the topic, just we shouldn't have too many dentists if it wouldn't fail within 10 years, but this is sad. So if you have a joint hip replacement or some other things, and I would say that you have 5 years follow-up and then you have 50% failure, nobody will choose it. But in dentistry, I think it's very common, and that's very sad. Defending this, that the oral cavity is an unpredictable environment comparing to internal things in the body. So there are different behavior of biting force and heat and chemical injury and a lot of things. So it's quite difficult to predict something. But that's why this meta-analysis should succeed, because we want to increase this failure rate, or decrease this failure rate and increase the success rate.